I realized that this was an underserved population of dogs that we could do something good for by establishing the pet shelter program at Penn. And that's where it started. And, it was easy to get funding for it because it's a very compelling story that people like to help dogs and they like to help dogs in need. And if there is a benefit that you can actually learn about breast cancer, then it's a double positive.
Hello, and welcome to the Veterinary Cancer Pioneers Podcast, the show where we delve into groundbreaking work of veterinary professionals dedicated to advancing the field of veterinary oncology. I'm your host, Dr. Rachel Venable, and I'm thrilled to embark on this journey with you. Today's episode is brought to you by Impromed, pioneers in AI-driven precision medicine for veterinary oncology. Their personalized prediction profile helps you make confident treatment decisions for your canine lymphoma and leukemia patients by predicting how your patient could respond to multiple chemotherapy protocol options. Learn more at impromedicine.com. That is IMPRImedicine.com. Hello and welcome to the podcast. Today we have a really interesting guest, Dr. Karin Sorenmo. I'm really interested to dive more into her story. So she is a professor emeritus of oncology at the University of Pennsylvania School of Veterinary Medicine. And she's the co-founder and medical director of Lesley's Place, a nonprofit that provides cancer care for homeless dogs. And just a really revolutionary idea on not just helping animals, but also learning more about cancer and comparative oncology. So really fascinating. I think we're going to hear a lot of really great information today, and just excited to dive into her journey from years in academia to her current work and making a difference for both pets and people through her nonprofit. So Dr. Sorenmo, thank you so much for being with us today.
Oh, thank you for having me. And I'm excited to talk about my favorite topic, mammary tumors and estrogen. And I am excited to share my story about how I ended up where I am today.
Yeah, that's fantastic, because I really want to learn more as well. And just to start, I always like to start at the beginning. What got you into veterinary medicine, or certainly oncology and mammary tumors?
Well, starting all the way in the beginning, my background is a little different. You hear that I have a little accent. Still, I'm Norwegian. I was born on a very small island in the northern part of Norway, just slightly south of the polar circle. But I knew early on that I wanted to be a veterinarian, but I wanted to be like a country animal doctor. And my hero was the country animal doctor who'd come to the island with his brown bag to take care of the cows. So that's what I wanted to do. So I went to a veterinary school in Oslo and I got my degree. And when I graduated, I thought I would do large animal country practice. And I did that for a little bit. And then I decided to move back closer to home. And I ended up in all places, meat inspection, which is a little different than what I thought I would do. And, clearly it was not what I dreamed about wanting to do. So I started to kind of look what I could do because I wanted to practice medicine. And even back then, it was the saying that everything is better and bigger in America. And I found out that you could actually specialize in small animal medicine in the American veterinary education system. So I decided I'm going to apply to that. And I applied for an internship in Gainesville, Florida. And I think I was both like scared and shocked when I was accepted. But, I had to go. And that really changed the trajectory of the rest of my career because it just opened up a whole different view of veterinary medicine and what it could be. Just learning from professors who were so good in medicine and caring for really sick, complex animals. So when I was finished with my internship, I thought, oh, I know it all now. I can go home to Norway and work as, an internist in small animal medicine. So I went back and, you know, it's one of those things with learning and knowledge. When you know very little, you think you know it all. And then you learn a little bit more. And then the doors start opening, recognizing the vast amount of knowledge out there that you still need to learn in order to be better at your craft. So I decided I needed to learn. And one of the things that frustrated me when I practiced in Oslo was how we treated animals with tumors, and I know sometimes it's done still here that, it's a tumor. Yes, let's send it to surgery. Or let's see if it grows and then we'll send it to surgery. And that really didn't seem right to me. So I decided, well, if I want to specialize, it's got to be in oncology. So I applied to Penn of the silliest reasons of all. And that was that it was closest to Norway than any of the other places. So I ended up again back in the US and I really never left. I spent my entire academic career mostly at the University of Pennsylvania. And I never really looked back. I think it landed me where I wanted to be.
It's really interesting. And I love how you saw a need. And so you just really went for it and was like, this is where we need some help here. So I think that's great. And you do a lot of work with mammary carcinoma, breast cancer, basically with people. And so what got you interested into that area specifically?
It started with a retrospective study, like so many things in veterinary medicine. So I wrote a paper on the effect and timing of ovarian hysterectomy, spaying in dogs with mammary tumors, because I thought that dogs that had mammary tumors, they should benefit from having some kind of hormonal deprivation because we know that hormones drives the development of these tumors. So when my paper was the first one that actually found that it actually could be beneficial, it received a lot of criticism. There was a lot of strong opinions. I think it's one of those things that when the data is weak, the opinions are stronger. So it's true. And so I decided that, well, in order to prove that this is real, you have to do a good study. You have to do a prospective randomized trial. But that was impossible to do here in this country because, working in universities, most of the dogs that came in to see us, they were spayed dogs that were spayed at an early age. You rarely saw mammary tumors there. But it's different in Europe and it's different in Norway. Dogs are typically not spayed there. So you do see a lot of mammary tumors. So I got funded by Morris Animal Foundation and we traveled back to Oslo. I took my whole family, including my surgeon husband, who came with, which was a very convenient pairing because he did all of the surgeries while we were in Oslo. And that was kind of like the beginning. And from that study and the data we collected there, my research had continued to build on that. So that was my beginning, diving into mammary tumors and the hormonal associations.
Why would you say in Europe, especially Norway, that dogs aren't spayed? In the US, I remember even as a kid, I don't know if you remember the show The Price is Right, but Bob Barker at the end would always say, spay and neuter your pets. It was a big campaign in the US, I think to really help with the pet population. But why is that not the same in Europe?
I think the main reason why that campaign is so strong and so important here in the US is that pet overpopulation is a problem. And that is not the case in Norway. It really wasn't. So there wasn't a big drive to advocate early castration or ovary hysterectomy for that reason. It seems to me that the decreased risk of mammary tumor was almost like a positive side effect from that initial intent of preventing pet overpopulation. So, since it's not a problem in Norway, it's was never really an issue, and it's also more about, I think, attitude about how to treat animals and not to create them to our and manipulate them and change them to our convenience, so that dogs should not be spayed just because it's easier for us to manage them. You see what I mean? It's that. So it's still like that. And it's still not a problem with pet overpopulation. So it's more of a societal issue, I think, the pet overpopulation that you're dealing with in this country.
Okay. Yeah, because it is more challenging. Certainly having an intact female dog, there's more involved with that than if they're neutered. And as I mentioned early in the intro, about Lesley's place, and so I kinda wanna talk about that with because a lot of those dogs are intact. Can you tell everybody what Lesley's place is?
Right. So when we returned back from Norway back to Penn, we wanted to build on the findings that we discovered based on so much of the data we collected in Norway. And I wanted to continue to work in mammary tumors. But again, the problem was the case population. It didn't exist. But I also had a moment of clarity, I think. And I asked my colleague at Penn, he was the head of shelter animal medicine. And I asked him, he's like, what about the shelter dogs? Are they spayed? And he said, no. And I said, do you see mammary tumors? And he said, oh, yeah, a lot of them. And I realized that this was an underserved population of dogs that we could do something good for by establishing the pet shelter program at Penn. And that's where it started. And, it was easy to get funding for it because it's a very compelling story that people like to help dogs and they like to help dogs in need. And if there is a benefit that you can actually learn about breast cancer, then it's a double positive. So the background for Lesley's place was really the Penn program. But when I retired from Penn, I wasn't finished with veterinary medicine. It's like I've done it for so long. It was pretty sad not to do it anymore. So, and my husband retired around the same time. So, and a few years earlier, we lost Lesley to breast cancer. And Lesley was my colleague at Penn. So she was an extraordinary veterinary. And she thought, let's start a program, name it after her, do a nonprofit. We did a lot of self-funding and name it Lesley's place so that she can still be remembered. I think she would like it. So that's what we did.
Right, that's such an amazing story, and I'm so sorry to hear that Lesley passed, but I think it's amazing that you name this nonprofit in her honor, so that is really special.
Thank you.
And with this nonprofit and even just your earlier work too, what is some of the major differences you would say in mammary cancer, especially between unspayed and spayed female dogs?
It's the frequency. Clearly, it's the frequency. So it used to be, accepted that if you spay a dog early, you decrease the risk for mammary tumors. But it was also one of those things that, if you spay a dog with mammary tumors, it really didn't make a difference. So that late spaying and hormonal therapy at the later stage in life didn't really affect the outcome of the mammary tumors, which didn't quite make sense. And I think the first retrospective proved that. And it's all of the other studies that we have done now, we have shown that this is actually true in dogs as well, that hormonal therapy later in life, when a dog has developed mammary tumors, it can do several good things. It can prevent new tumors in other glands. which is very common actually. 60 to 70% of the dogs, if you leave them intact, they will develop new tumors in other glands. But if you spay them, you cut that risk in half. And that is the same with both benign tumors as well as malignant tumors. And similar to women, if you have more of the high risk estrogen receptor positive tumor, if you spay that dog as well, you can actually decrease or delay the onset of metastatic disease. So that is very similar to what you see in women. Hormonal therapy is still one of the most effective treatment in women, postmenopausal ER positive breast cancer in women. And it has been like this for 30, 40 years now. So the dog is similar to women in many situations, and we still, learn so much from human breast cancer, and we can apply a lot of that to the dogs.
That is interesting because I certainly remember learning, if you spay them younger, like if they haven't had a heat cycle yet, the likelihood of them getting mammary cancer goes down. Now, some of that, as far as when to spay dogs, has changed. I've noticed in the last few years, people are waiting longer. What are your thoughts on waiting till the dog is older? Have you noticed, or are we seeing? I know you said if they're intact in general, we see more mammary tumors. But what about the people that are waiting until their dog's a year, maybe 2 years old before getting them spayed? Do you notice if there's any difference with developing mammary cancer?
I think that this idea of waiting a little bit is influenced by observations that dogs that are spayed early, they may have a higher risk of more aggressive tumors, such as hemangiosarcomas, lymphomas, osteos, in certain breeds. So I think the recommendation regarding spaying depends on a few different things, like what is the risk for mammary tumors versus what is the risk for these other more fatal tumors. And, the reality is that mammary tumors, for the most part, is a disease that if it's detected early and the tumors are small, they can be cured. And they can also be detected by the owners, right? You flip them over, you feel them. With hemangiosarcoma, it's different. Splenic hemangiosarcoma, the owners may not have any idea what's going on with their dog before they have an abdominal bleed. And by that time, it's a fatal disease in most cases. Same thing with osteosarcoma. It's highly metastatic. Amputation helps for a little bit. And so mammary tumors are different that ways. And it's also breed differences. Smaller dogs, if you look at the epidemiology of mammary tumors, you see that a lot of the mammary tumor high risk breeds are the smaller dogs. So, and with the larger dogs that you see, Humangio and Osteo and Lympho, and they are the larger breed dogs that don't have a lot of mammary tumors. So you can, be a little bit more, I think, specific in your recommendations and say, well, if you have a small dog and if you have an owner who is somehow unable to monitor the mammary glands because, people have different abilities and maybe they say, well, I don't want to risk it. I want to spay my dog early. I think that's a reasonable decision. But if you have a larger dog, maybe delay a little bit. I don't know when the right time is, whether 2 years or 4 years or never. I don't know. But I think these are questions that I think could help owners make informed decisions about if or when to spay their dogs, depending on their ability to monitor and the kind of dog they have.
It makes a lot of sense, really. Like you said, mammary tumors, a lot of times they are easier to detect, certainly more so than some of those other cancers. And So it is interesting how things are shifting a little bit from, before we would always say, usually before 6 months, to
Right.
get them neutered. And now I'm definitely seeing, dog getting older, staying more intact. The other thing that was interesting, like you mentioned earlier about the hormones, we didn't used to think that was such an issue in dogs, but now it is. But I would say that I don't typically see too often where we use hormone therapy as a treatment in dogs. Is that something that you think needs to shift, or have you found in your research like maybe we should look at more actual hormone therapy?
Well, hormone treatment, I think of ovarian hysterectomy as hormonal treatment. It's hormonal deprivation. So basically, it achieves the same effect as using anti-hormones or anti-receptors. In women with breast cancer, they use tamoxifen to block the receptors so that estrogen is not triggering, cellular proliferation and malignant transformation. So removing the ovaries removes a big source of hormones, both estrogen and now I'm thinking maybe also progesterone. The two of them play together here. So hormonal therapy is, can be many different things. It can be medical or it can be surgical. And for dogs, people have tried tamoxifen in dogs, and it's not really tolerated. You see pyometra, stump pyometra. So it's not necessarily, an effective way to go, but removing the ovaries are clearly an effective way to go. So I think you can use that instead of medical therapy.
Mammary tumors, they also just seem to be very diverse, right? Where you have some that, like you said, removing, like doing a spay can help with prevent other tumors. But then sometimes we see these in spayed dogs, dogs that were spayed when they're younger and they have more aggressive. So what would you say, even just how challenging that can be in itself amongst pathologists and clinicians and things?
I hope that the take home message from the meeting we both went to is how complicated it really is. And, I think the more you dig into it, the more do you appreciate the complexity of the diversity. And it starts with the pathologist. Mammary tumors, there's so many subtypes. And you have to have pathologists who really understand mammary tumors in dogs, in order to get a good, useful diagnosis. And then on top of it, different continent, like in South America, they use a different classification system compared to the system that we are used to from, Goldsmith, Pena, and Sepoli. They use the system that I'm used to. So when I read papers from South America, I don't know what to do about it. I don't know how to implement their findings in my decision makings because it's so different. So it's like speaking different languages. So it starts there. But, when you're talking about the tumors that we see here and the different types and the subtypes and the grades, I think that a good memory pathologist, they are typically in agreement when it comes to the more aggressive tumors. I think where the pathologists sometimes are disagreeing is those very early stage or early transitional tumors that, it transitions from adenoma, a benign tumor, to a low grade carcinoma. That's where it gets tricky and it can be complicated. But you can always say, well, it's just a academic issue because they're low grade, so they're not going to behave aggressively anyway. But, the aggressive ones are a challenge for us because we really don't have effective therapy to offer to the dogs that you don't think will respond to hormonal deprivation. So that is just something we need to get going on, I think. Figure out what drugs and what to use, how to treat them.
Yes, and I think it's so important what you said about the different classification systems because before we talked in the conference, I didn't realize that South America was using a different system than North America. I didn't realize they were using a different thing. And so that's really interesting to think about, when you read through a lot of these studies, it's not a side by side comparison. And so it does make it challenging, because I agree. I feel like it's challenging to know how to treat some of these mammary tumors in general, especially the aggressive ones, as you mentioned. What is the best treatment? Or sometimes it's, when do you start treatment? I find that can be a challenging, with some of these dogs. Do they need therapy yet or not? What I guess in your practice, are there certain features where you really decide that, okay, this dog definitely does need more than just surgery or being spayed versus we can, surgery and being spayed should be sufficient?
The shelter program, we are not in a position to offer systemic chemotherapy for these dogs. We can offer non-steroidal sometimes, which may maybe have some benefit in some of the aggressive tumors, because we are a shelter program and we don't have the resources and the staffing, and we don't really want to put these dogs through chemotherapy, especially when we don't have good data that will make a difference for them. I know that veterinarians all over America gives chemotherapy to these high-risk tumors because they feel that without it, they are going to die from metastasis. But the data, like it's very weak and inconsistent. And I think some of it may be because of the way the studies are conducted, that they're too small, they are retrospective, and they are not really well-controlled studies. So we still lean on that and say, oh, it may help, but we don't really have the data. So the shelter dogs, they get follow-up, and the fosters, they are often advised to say, your dog has a high-risk tumor. And you can read that based on the biopsy, so you can prognosticate them pretty well. They said this dog is not likely to do well long term. And if you're interested in getting more treatment for your dog, you can go to an oncologist. But this is beyond what we can provide. Most owners don't go for it. They elect not to. And I understand. I understand. It's a very different commitment beyond the one that they've already taken on by fostering these dogs.
Sure, and especially, if you're adopting or fostering a dog that has cancer, right then, I just commend those people for taking on those pets, and I think it's great that you're able to do surgery and give those pets kind of another opportunity, another chance, um, and and I definitely understand too, some clients not wanting to do chemo or just kind of nervous about all that. What about hormone options? Have you found, or is there anything exciting maybe on the frontier for some of those dogs that have been spayed? I know we just talked about tamoxifen and spaying. Is there any other hormone or anything else like that, or maybe targeted therapies that you think are on the forefront or exciting?
I don't know anything that has been published that I can use to answer that question. And I think that here in the US, most of the university, academic institutions, they don't have the caseload to actually test it out either. But, and with hormonal therapy, then we get into the estrogen paradox, and which is, really the up looking at how estrogen is not just a bad cop, it can also be a good cop. And the fact that we have found that dogs that have high estrogen after surgery, they do better than the dogs with low estrogen. And some of the data that I presented at the meeting, that dogs that have high estrogen, and we have collected more data from Lesley's place now, that we show that it's a very different pattern between dogs that continue to have elevated estrogen and increasingly elevated estrogen after surgery. They don't develop metastasis. Whereas the dogs that have maybe lower estrogen and don't have that elevation, they develop metastasis very, very quickly. So this idea that I had too was that I would test out aromatase inhibitors since they didn't tolerate tamoxifen. I said, well, that's the other option here. I tested it out in maybe a few years back and tried to see if I could drop estrogen in these dogs. It didn't budge. There's something different with the dogs. I think it's almost like the biology in the dog knew better than I did. And it didn't go down, which I think is a good thing because the dogs that maintain elevated estrogen. So that brings us back to, how estrogen works to drive breast cancer. And it seems like, some of the findings and looking at all the bits, pieces of the puzzle, that estrogen works differently when it's by itself versus when it is working together with progesterone. So an intact dog with high estrogen is more prone to develop breast cancer. But a dog that have high estrogen with removed ovaries, meaning that the progesterones are not there, they actually benefit from having high estrogen. And that brings us to that dream complex activation and inactivation that I think is so fascinating that maybe, I would love to be able to test this out in dogs with mammary tumors that have low estrogen to see if the progesterone is low, if you can change the outcome. Because, in the 50s, high estrogen was actually used to treat the women with metastatic breast cancer. And it had the same response rate in those women with metastatic breast cancer as tamoxifen has. So either feeding them estrogen or blocking the estrogen had the same effect. I mean, these days, people don't use estrogen because of the fear that it may, enhance cancer progression because they don't know when it's going to be working in the favor or when it's going to drive more cancer to develop. And since they have other drugs to achieve the effect that they want, anti-cancer effect, they stay away from it. But it's very interesting what we have seen in the dogs. And it's clear that it's a very complex story. And I think that we can learn so much from the dog by looking at the dogs after surgery and looking at where the hormone levels go and how they are trending. Because it all makes sense when you put all the pieces together. And that's what's so fascinating about, the biology of breast cancer.
Right, that it does seem confusing because on one hand, it's like, no, estrogen's bad, it causes it.
Yeah.
But then you
Yeah.
said on the other hand, if they have high estrogen, it treated metastatic disease. So, yeah, that
Yeah.
is confusing, and I agree, it would be nice to get a study to better tease out what's happening there, and, as you mentioned, there really is some links between dog mammary cancer and human breast cancer. What are some other insights that you've seen, especially looking at the 2 of these as a comparative model?
Well, I think that veterinarians are very excited about the spontaneous tumors in dogs being models for cancer, the same cancers in people. And I'm thinking that we are being heard, but we are not being heard well enough. And with breast cancer, I think that the information stream typically goes one way. We look at what we do in humans with breast cancer and apply it to the dog. Very little, if anything, goes the other way. But I do think there are some of the differences, I think, between dogs and people can actually be used to kind of provide a different light on the problem and provide research opportunities. So in dogs, you see so many dogs that are older, they're intact. They don't have just one mammary tumor. They have multiple. I've seen dogs from the shelters that had tumors in all of their glands and multiple tumors in their glands. And so what's fascinating with them is one of the things that we published on earlier is the progression from benign to malignant, and that the dog can serve as such a good model and natural model for breast carcinogenesis, because you can study how it happens in one dog with multiple tumors at different stages of malignant transformation. And if you collect tissues from all of those tumors in one dog, you can compare the dog to, to itself, basically. You don't compare it to a dog that has also tumors, because genetically they might be different. They are different. But if you collect it from the same dog, you can clean out all that background. So I think that is just a unique model that we haven't necessarily used enough, or, tapped into enough. And the other thing is the estrogen paradox, the fact that estrogen can work both ways. Again, because the cycles are so different in the dog than in women, that you have longer periods of non-cycling, like estrus, maybe twice a year or something like that. So maybe it's cleaner, and then so it's easier to kind of tease out what is what in the dog. So I'm excited about learning more from their dogs. So that's why I continue to do this.
Right, and I think there is so much we can learn. So I think that's fantastic that you really have, kind of roadmaps, plans on what to do, and speaking of that, you've been working with, some researchers in Florida on sequencing mammary tumors, looking at different genomic studies. What have you guys found anything interesting there so far?
Well, we published one paper, and that started actually. It was published out of Princeton, because that's where the collaboration started, and looking at molecular modeling of breast cancer, and looking at the dog models, and looking exactly at what we did. And so we published that. This kind of be several years ago now, which showed that, in dogs that have histologically benign tumors, you see a lot of molecular dysregulation, specifically at the RNA level, even when they are benign. So that's, I think, in itself is very interesting. Florida has all of my tumor tissues right now. And I think that I'm hopeful that we can learn more with that kind of research. That, like with so many things these days, funding is a major obstacle. So we haven't been able to move forward with the sequencing that we wanted to do to learn more from those samples. Because the good thing with the samples is that it's not just the samples. We have the clinical data. They know what happened to these dogs. They know if they develop metastatic disease. So without that information, the molecular sequencing is not so useful. But if you have it all together, that's when you can learn something.
Right, exactly. You do need just the whole puzzle, not just one little piece, right? So
Right,
that
right, right.
that makes a lot of sense. And, kinda to switch gears, to go back to Lesley's place, I think that is just such a cool thing that you are doing there. And I'm sure you've seen all kinds of, situations and stories. Do you have a couple stories that you can think of where, these dogs maybe had bad tumors but were able to go to a good home?
I first want to say something about the fosters here, because they are a story in themselves. And without the fosters and the fosters' willingness to take these dogs home with tumors, with an uncertain future, and provide a home for them, and to bring them back for the follow ups. If we didn't have that, we wouldn't be able to do this work. And they are the nicest, most generous people you can ever bring to meet. So when it comes to stories, I've been. It's hard to pick, because so many of them, they come to us with nothing. Found on the street, debilitated, matted, hungry, and you know nothing about. But there are some that you know more about. And I think that one of the dogs that we just lost. Even though it's a sad ending, I think her story is still wonderful because it just shed lights on the suffering that these dogs, go through, but then the healing that they also receive when we care for them and give them a home. This is a little rescue. They they drive down south and they have connections and they work with a lot of puppy mills, people who overbreed dogs. They breed them to the grave almost, because the puppies are valuable. And then when they get sick, they are just put aside. They don't get care. So they drive down there from New Jersey with their truck, pick up the whole flock of Cavalier King Charles. Can you imagine? And they drive them up, and one of them they brought to us, and she was a Cavalier, so she had pretty severe heart disease. She had oral abscesses. She had a really large tumor, and she was pregnant. And she was a challenge for me because none of us want to have a dog die during surgery because we are trying to remove a tumor. And we got her a cardiology consult. I usually don't aspirate mammary tumors because I don't necessarily trust it. And I also think it's a dynamic disease. So even though it might be benign today, things change over time with these tumors and there's a transformation. So I did aspirate her tumor because I wanted to know whether we needed to rush or not. And they said it was cytologically, it was a benign tumor. So we had time to stabilize her heart disease, to let her have her puppies. And of course, the puppies were stillborn. But she was placed in the most wonderful family. And she just loved them. And they loved her. It was funny because when they came in with her, she would not, her eyes were locked on her foster mom. She wouldn't let go. And she was the sweetest little girl. And, after she had her puppies and her heart was beating, and she was like, she was just like an amazing little dog. Just like, it's now or never. We need to take it to surgery. So we did. And her tumor was malignant at this point, histologically malignant. And she recovered spectacularly. She went home and she did well for almost a year when her heart gave up. And so, it's one of those stories. It's never just beautiful. It has a little hurt and hardship and sadness in it. But I think that's what this is about. It's not always going to end well. But in the meantime, we can do something right for these dogs.
Right, and it sounded like she was just so happy to have a real home and,
Oh, yeah.
and this some of those puppy mills. I'm from the Midwest, and so there's a lot of puppy mills in the Midwest, and it is sad, and I think the general public just has no idea when they buy these puppies for thousands of dollars. I mean, it's expensive, some of these dogs. I think they just don't understand where it's all coming from, you know?
Right. Right. It is. It is.
Yeah, but I do love that story. That is a really sweet story. And one thing I am kind of curious about, I know as you mentioned, doing aspirates and cytology, it's not always, a good representation of what the tumor will actually be under the microscope under histology.
Right.
But how long of a period was it roughly, would you say, from when you did the aspirate where it didn't look that aggressive to when you removed it and it was aggressive?
It was probably 5 months.
5 months?
Yeah.
So do you
And
do you
it
think
grew. Yeah.
transformed?
I don't know. Cytology, I think it gives you such a small sample of the tumor. And we know that even histologically, they can be quite a bit of heterogeneity within sections, depends on where in the tumor you get it from. And and then it's the other thing is that pathologists even sometimes have a hard time differentiating between the low grade carcinoma to a benign adenoma. That transition, I think, is hard to capture and agree upon. So I just find it hard to believe that cytology can be that useful. But that tumor did grow though. So I told the owners to keep an eye on the size. But sometimes when you say that without giving more specific instructions, it can be difficult because they see the tumor every day. So they don't notice gradual changes because that tumor grew with about 2 to 3 centimeters over that time. So it did grow. Yeah. So I don't know if it was a wrong cytology or a tumor that transformed over time.
And it is really interesting, and, like we've been saying quite a bit on this podcast, that it keeps changing. These mammary tumors are complex. It's not a simple yes or no, or, if you get this answer, you go this way. If you get that answer, you go this way. It certainly is confusing. I know whenever I see mammary tumors in practice, I usually kind of double check literature and double check because it's not really clear with, again, some of these more complicated cases, what's the best route? And what would you say, or something you would like to see change, maybe even worldwide, on how we diagnose or classify or even treat these mammary tumors?
Well, I think that the first step is to have people that see these tumors more commonly. The pathologist from Italy, Dr. Sappoli, and the pathologist from Brazil, Dr. Casal, work together to see if there's a way of presenting the data on histology two ways or a translation. So that you could understand what they are reporting on, regardless where you are in the world and what kind of classification system you're used to. So I think it starts there. I think the other thing is that we need to do good trials. We need to do, select the dogs that are at risk and agree upon what criteria constitute the risk for metastasis and use those dogs and do randomized prospective trials and use the same endpoint so that you measure the same thing. And then you can all look at all the cases that you collected together and have enough power to have the answer that everybody can rely on and be useful. And we don't really have any system for that at this point. I think that the conference started a conversation, which I think that's where it has to start, right? And increase the awareness of how complicated it is. And my communication with the members of the panel after has been only positive. Everybody are excited. So, I think that it is a start, but there's a lot of work that needs to be done.
Well, and I think you've definitely done a great job. I agree that the conversation really got started at the conference, and people like myself who wasn't even aware of some of these differences, I think that really brought it to the forefront, and I'm glad to hear that the panelists are all encouraged and talking. So I'm hopeful too. I hope we can get a better classification system, or more agreement, so we can further figure this out. And the research, like you mentioned, getting some good clinical trials and agreeing up front, the
Right.
inclusion criteria and everything. I agree. I think that sounds great. And I certainly hope that anyone looking for research projects, like, that is a great one to take on. And
Right. Right.
Dr. Sorenmo, I'm so glad that you're on this podcast with me today. It was so interesting hearing all the different things about mammary tumors and just the complexity and the stories behind Lesley's place and just what you're seeing. And the final question I always like to ask people is, who is another guest that you would recommend for this podcast?
I'm kind of thinking maybe, since we talked so much about pathology, what about inviting a pathologist? I think that could be very useful. Mammary tumor pathologist obviously comes to mind for me, but Dr. Zappoli, you heard her speak at the conference. She's an excellent speaker. And this is, one of her areas of expertise. I think she has such a good grasp of the situation. Oh, I would love to hear Dr. Goldsmith being interviewed. He's retired now for 10 years, but he was like my pathologist at Penn for so long. And, without him, I couldn't do the work because, like I said, the pathology can be so inconsistent. And he is, one of the forefathers of mammary tumor pathology. So I would, yeah, those are the ones that I can think of. The other person, this would be interesting, is Dr. Lily Duda. I worked with Lily for ever since I started back at Penn. She is a radiation oncologist, but she is also, she has a master's in veterinary ethics. And it's an area that is, close to her heart. She's very eloquent. She's got strong and clear opinions. And I'm kind of thinking it would be interesting to see how she sees how things are done and, from an ethical point of view, because it is maybe something to consider these days where, things are expensive and tests are expensive and what do you need to do? And, yeah.
Oh, those are all really good suggestions because we haven't had a pathologist on. And so I think that would be a great one to have, just get their take and what they're seeing. And then also ethics. Yeah, we haven't done that either, but that is a great conversation because I feel like also when you look at different aspects of the world, so even like we've talked with mammary tumors, I've also found just when people euthanize is different based on the different cultures. I've talked with a group in Japan and they usually don't euthanize. A lot of their, clients will pursue a natural death versus I've talked with some people even like with Europe or Northern Europe where they say actually people will sometimes euthanize sooner and just, so I think and also what you brought up as far as costs and just different, there's a lot of opinions on whether you should treat your pets for, chronic or diseases that aren't curable in general. So that ethics would be a really interesting talk. I didn't even realize there was a degree in that. So that's really fascinating to me.
Right. I don't know if it was specifically veterinary, but it was in ethics in medicine. But as a veterinarian, she made it apply to her field of work. So yeah, no, I don't know if there's anybody else like her who does that.
No, that's awesome. Those are really interesting and good choices. And the other thing that I would want to bring up for people is there a good way for people to contact you maybe about Lesley's place? Do you have a web address or something like if people do know of any dogs that maybe need help or mammary tumors, that kind of thing? Is there a good way to reach you?
Uh, I do get people reaching out via the website. My email is there, and there's also an email on the website that people can use. And the website is www.lesliesplace. It's all in one word and .org.
Perfect. Well, that's awesome. And I just love the work you're doing and hope that it continues and just really excited to see what you find. And we'll certainly keep an eye on what you're up to. So, again, thank you, Dr. Sorenmo, so much for being on this podcast.
Oh, thank you for having me.
Well, that's it for this episode of the Veterinary Cancer Pioneers Podcast. If you enjoyed this episode and gained valuable insight, we would be so grateful if you could share our podcast with your friends and colleagues. And it would be even more wonderful if you want to give us a 5-star rating, positive review, or any kind of feedback on Apple Podcasts or wherever you listen. The Veterinary Cancer Pioneers Podcast is presented to you by Impromed.